Alright, so we have frame of reference is continued. Neurodevelopmental treatment, otherwise known as NDT. The focus with this theory are preparatory treatments for a variety of diagnoses. It helps direct the treatment towards establishing better sensory motor performance, which is important for occupational performance. Handling, which is where the patient is placed in a position that reduces spasticity, such as quadruped, is the hallmark of NDT. The patient lacks the ability to perform in important occupational areas such as leisure, social participation, and dressing. To increase her postural strength while standing, the therapist could have her complete activities such as hitting a soccer ball back and forth with her hands in quadruped. It is important to have the therapist place their hands at the hips and shoulders, the key points of control according to this theory. One theoretical basis of NDT states that movement controls progress from head to toe, trunk to limb, large to small, and gross to fine. For shoe tying, it could be important to first engage the gross motor muscles in the hand before trying a fine motor task. So having the patient play with their putty and then finding the beads in the putty to engage the motor muscles could successfully prepare her to participate in a shoe tying activity. Using two of the specific, not general concepts you have learned this semester thus far, please describe in detail how this could relate to the evaluation and/or treatment of this patient. You will first describe what it is that you are reporting on, and then in detail how it would relate to your patient. After you relate this to your patient, please relate this directly back to one of your two formal theories previously selected and one specific frame of reference, using the terminology utilized in the theory. You do not have to relate to both, but generally what sub-frame of reference and what form of theory could you relate to this. Also, please include either one research article or HEP that you or someone else has developed that relates to your treatment you have found that substantiates the use of one of your treatments. The HEP could be used as a treatment, and of itself, if you would like so. We will briefly discuss this as well. So our SI intervention would be an obstacle course. So this activity will allow an in-depth evaluation of the patient's skills, of their somatosensory, proprioceptive, vestibular, and visual systems in relation to their diagnosis of developmental coordination disorder. Therefore, this information will allow a more customized intervention to improve upon bilateral coordination and balance for the patient. An obstacle course would be related to the occupational adaptation theory, but it is being used to evaluate the patient's adaptation process from a systems viewpoint. The obstacle course incorporates the occupations of the patient is a part of, the opportunity to learn and adapt, and the process of occupational adaptation due to the patient's portraying all forms of mastery to achieve such outcomes. An obstacle course relate to the neurodevelopmental theory, NDT, frame of reference due to the activities throughout the obstacle course addressing deficits in movement through position, and promotion of normal movement patterns to achieve occupation. So our second specific concept would be pelvic floor strengthening activity. So pediatric yoga poses and stretches can be used to help strengthen the pelvic floor muscles and have greater control over them. Core strengthening exercises can be utilized, such as crab walk soccer, prone exercises, and wheelbarrow races. Abdominal massage and myofascial release of tight muscles of the pelvic floor can be utilized. And keeping a bladder diary documenting the type and amount of food or fluid consumed, amount of urine voided in ounces or seconds, amount of urine leakage that occurred when initially voiding bladder contents, was there an urgent to urinate present, and if there was a leakage, was an activity being performed during the leakage. So this specific concept relates to the child's nocturnia and uresis and provides intervention details to help minimize these episodes from occurring. our specific concept continued. And pelvic floor strengthening relates to the occupational behavior theory through using the work-play approach, incorporating childhood activities to advance the patient's development of occupations and productive activities. It overall will prevent and reduce incapacities of occupational behavior, including increasing strength of transverse and rectus abdominis and urinary continence. The patient will explore new pelvic floor strengthening exercises, eventually acquiring competence in completing such exercises and achieving a level of attainment. Pelvic floor strengthening also relates to Rude's sensory motor approach, which utilizes the 8 neuromaturational sequences. The 8 neuromaturational sequences are supine, withdrawal, rollover, prone extension, neck co-contraction, prone on elbow, quadruped, and standing. And these 8 neuromaturational sequences can be used when performing yoga with the child during treatment sessions, and it is also a factor when participating in core strength exercises. So our group chose an HEP to use. And we found a HEP for nocturnia and uresis. And it is important for the patient to have an incontinence exercise program, which includes the following exercises. It has pelvic floor exercises, transverse abdominis contraction exercise, a hip adductor roll exercise, a hip abductor roll exercise, a combination hip adductor abductor roll exercise, a supine / hook lying hip roll exercise, and bridges with hip roll exercise as well. So this HEP can initially be used as a treatment until the exercises are learned and understood by the patient. So after the exercises are learned, they can transition into a home exercise program to allow for additional intervention techniques, methods, and activities to be performed while the therapy session is in order. Alright, and then finally we have balance assessments for pediatrics. So the pediatric balance scale, this is an adapted balance assessment for the pediatric population from the Berg balance scale. This scale provides a measurement of functional balance for school-aged children with mild to moderate motor impairment. The total testing and scoring time is under 15 minutes and does not require any special equipment. However, it does not test the child's ability to reach overhead or assess balance during functional mobility. It includes 14 items including sit to stand, stand to sitting, transfers, standing unsupported, sitting unsupported, standing with eye closed, standing with feet together, standing with one foot in front, standing on one foot, turning 360 degrees, turning to look behind, retrieving objects from floor, placing alternate foot on stool, and then reaching forward with an outstretched arm. Each one of the above items were scored on a scale from 0 to 4, and the best of the 3 trials is taken. A demonstration of this assessment can be viewed at this playlist. Alright, and then here's our reference page. I just wanted to thank everyone for watching and hope everyone's doing good during this quarantine that we are all experiencing. And again, my group thanks you for watching, and have a great day. Goodbye.